Today, on the final episode of Eye on Dependency TV, we take a look at the life of my co host, Garth St. Clair.
This is a reminder of where my journey began and the key messages of hope and strength that are the foundation of what we do. My journey started in Coquille Village in San Fernando, the eldest of 3 children, a brother and a sister, my mother and father, and it would be considered now the politically correct thing to be a dysfunctional home. My mom was a very strong lady, and she tried her best to keep us together, despite the fact that my father, seemed to be a playboy of sorts. Hearing them fighting all the time, sometimes 2 in the morning, sometimes 3 in the morning, during the day, we couldn't understand what was going on. All we knew is that, mommy and daddy were always most of the time fighting. There was hardly a time when I could recall that we had laughing moments. They were few and far between. It was hard to be jolted out of your sleep with, mom and dad quarreling and then have to go back to sleep to get up to go to school. I remember, I think what was the last straw, I was one morning, I woke up in time when he came home. As usual, mom confronted him and I saw a right hand flush to her face. He hit her right hand and threw her down. That's a sound I will never forget. Yancy, tell us, in domestic abuse, what role would it play with regard to predisposition to addiction?
Well, we are all a product of our environment, but in terms of addiction, there are a number of factors that determine how you become as an adult in later life and the things that affect you. I mean, in your instance, you heard the sound of your father hitting your mother, and that must have affected you in some way. In terms of the addiction, people turn to substances as a means of comfort. There are also people who are genetically predisposed to having addictive personalities. So I know if you're looking for the reason why, there are a number of reasons that would have impacted on your life.
Michael, what are the preventative factors that may have existed that maybe he overlooked or his family may have overlooked in terms of his journey as a young adult?
The preventative factors whilst he was a child.
Yeah.
I mean, we know what children need, don't we? Children need love, children need stability, children need to feel safe. And if he was a child that didn't have that, then that would have an impact on him. And one of those impacts could have been to predispose him to problematic behaviour later on. There has been some research, I'm not an expert on this, but there has been some research in Michigan in the USA where they've done brain scans of children who were exposed to domestic violence. And what they noticed was that there was a change as they went into their teenage years in their hippocampus.
Yes.
And the change in their hippocampus might have predisposed them and predisposes them to problematic behaviour, including problematic drug use later on. And so there is some kind of research around that. But we do know, as Yancy says, that if children don't have the things that they need, that it predisposes them to problems in later life.
So, Michael, for the uninitiated, what is the hippocampus?
The hippocampus, well, that's the part of the brain that kind of deals with our emotional selves and that kind of deals with emotions.
Great.
And you wanted to jump in?
Yeah, I was just going to say actually that one of the things that support people through their processes in life is building emotional resilience, so the way that they respond to circumstances that they've endured.
Funds have been raised by countries, especially in Europe, to pre-finance the development of the vaccines, because it is a pandemic. It's not just an epidemic, or it's not just in a few countries, it's a pandemic. So there's been an unprecedented drive, never before done, never, of the vaccine manufacturers working with WHO, working with the Gavi Alliance, which gives vaccines at no cost to many low-income countries. There are three arms to this whole program, but the COVAX is the vaccine arm, and the funding has come, as I said, from several countries, especially in Europe, that have pre-financed the development of the vaccines in several countries to several manufacturers at the same time. And they said, okay, we're going to give you the money, ready, set, go, start working on the vaccine.
Yeah, there were some things that was said during the time my mother and father were arguing with each other that really affected me, that made me feel that I wasn't part of the family. Let me just put it that way. You know, that I was the, as we call it, the black sheep of the family.
The house is just at the back of this house. As a child, it was miserable.
I was more attracted to sight, sound, culture, music.
Where the other two siblings would be quiet, you could get them at home, not Garth. He was always more extrovert, always outgoing, always mixing with the boys.
My brother was more, was closer to my father than I was. I was closer to my mother, you know, but ironically, I resemble my father. So it was a kind of pulling and tugging between both parties. I didn't know who to believe. I just didn't care no more. I just wanted to bury myself in sport and culture.
He was the one that always got into trouble. He was the one that would get licks.
There are certain truths in life, that nothing lasts forever, and no matter how challenging things seem now, it will all pass. That the world is full of endless possibilities, and all of life is precious. But we are all connected on this beautiful earth we share together. And everyone needs someone to be there for us when it matters most. No matter who we are or where we're from, one way, one world. Live easy with Guardian Group.
Well, Garth was always into sports and even music. In school here, they had a band. So he was involved in that. Other than that, it's just whatever, school activities, sports, that kind of thing. He was into all those things, even in junior set. Very athletic.
I buried myself in that so that maybe, now that I think about it, maybe it was a chance for me to be away from home as much as possible. Because when my father left home, my mother now having to take care of all of us. Somehow it happened by a miracle. As soon as my father left, her father visited us, that was my grandfather, and it's as if he knew he was going to pass away. So he handed over a contract. He was a contractor at Point Epi at the time, Texaco, when they were here, and he handed over that contract to her. She was one of the first female contractors in Texaco. I, of course, didn't leave school with full passes, and I became her driver essentially, and I started working in the oil field with her. My mother, at times when she gets angry, she would refer, "You're stupid just like your father. You're worthless just like your father. You're dotish, your head big just like your father." It started to affect me because I felt that I was being targeted by my mother because I maybe resemble my father. So after a while, I felt that too much attention was being paid to me and I was being made to feel I was this terrible person. So I decided I was going to join the army. In March 1982, I decided I was going to do the army exam. I didn't tell my mother anything. I didn't say a word to anybody. I did the exam and I passed the exam. The 14th of April 1982, I was called to the regiment. The night before, I started packing and my mother asked me, "Where are you going?" I said, "Well, I'm going to join the army." And she laughed. She didn't believe me. And the next morning I was up and she walked up behind me and she said, "You serious?" I said, "Yes, I'm serious." And I hugged her. And I will never forget that morning. She stood by the door and she looked at me walking up. And I keep saying to myself, "Don't look back, don't look back." I did. I looked back and she was standing by the door crying. And I started crying walking up that road. So when I reached Port of Spain, Independence Square, and I saw all these young men gathering, I felt like, well, I'm leaving a safe haven now. I'm going into territory that I don't know about. And then this huge green truck pulled up. And this corporal jumped off, this Lance Corporal. Well, now we know that he had one stripe. And I remember him jumping from the front of the truck. He had a big yellow armband marked RP on it. The Lance Corporal jumped out the back and started backing from before he hit the ground. Big set of noise on Independence Square and have everybody shuffling like this. And I felt good. You know, when these young guys around me mumbling under their breath and "Who the hell you feel he is, boy, I'm talking to you so and I felt good. And I'm saying, but something wrong with me or something but it was actually somebody paying attention. And when we reached Tetron Barracks, that truck, I remember I was looking through the back of the truck and they were taking us into this forested area now. Now it's the first time we go in Tetron. Huge trees and a long winding road, truck just going round corner, and I'm seeing these huge trees just leaving us in the distance and the sun coming up. I felt like I was going into another world. But strangely enough, it felt good that I was leaving one world behind and going into another world.
Now, Yancy, what are the red flags that you picked up during that last part of the story?
I mean, for me, the thing that stuck out the most was Garth saying that he referred to his home as leaving a safe haven. And prior to that, you spoke about it in such a negative way. So somewhere in there, you realized there was love amongst the negativity and the beatings.
Speaking about finding a safe haven, we always hear about young men finding that love in a gang or on the block. What is commonplace there with what you've heard?
I mean, the thing that I noticed about your story, Garth, was how your emotional resilience was actually kicking in. Yeah, you were looking for spaces outside of your home all of the time where you might be safer than you were at home. Your teacher talked about sports, music groups, all sorts of activities away from home which were keeping you safer, you thought, than you were at home, ending up with the army. And in terms of gangs, is that I think that what we know is that these young people are also looking for a safer place to be than the place where they feel unwanted, unloved, unoccupied. And it's just that they're turning their heads to the wrong spaces. The psychologist Carl Rogers, if I could kind of mention something from a book, please. But the psychologist Carl Rogers says that we all have within us the internal material that is always trying to take us to where we need to go. Yeah? And our emotional resilience is a part of that. Our system will always try to take us to what we need. And if what we need is belonging, our system will take us to belonging. It's just sometimes it will be the wrong place. We'll end up in more dangerous places than the places that we're running from.
Some of us like to play games of chance. But remember, gaming should be fun. So don't get carried away. Play for a prize, but don't pay the price. Play for fun, but never for keeps. Play smart, but never play all. Winning isn't everything. If you or someone you know needs help, call our gambling addiction hotlines. Rebirth House 24-hour hotline 466-3146 or Serenity Place Empowerment Center for Women 794-7980. An initiative of NLCB and Eye on Dependency.
Even though there are many dangerous drugs available out there, crack cocaine is still accessible and sought after by many users, despite its harmful effects. The abuse of this substance often leads to jail, institution, or death, not necessarily in that order. Or it can turn you into a street dweller. It can be used in many ways: smoked, in black cigarettes, piped, in a Zush bottle, or other device, freebased, or injected. Most users get hooked from the first hit, which progresses to frequent use, dependence, and addiction. Most users will spend an entire salary on the drug while neglecting the needs of family, ignoring commitments like paying monthly bills, etc. This can eventually progress to selling of possessions, neglecting personal hygiene, committing crimes like petty theft, armed robberies, all in search of that first euphoric feeling.
Enjoy Simply More with a Digicel Prime Bundle. More data to listen more with D-Music. Watch more with PlayGo. Cheer more with Sportsmax. Tune in more with Go Loud. Get 25 gigs plus dedicated LTE data for apps for 30 days for only $249. Dial *323# or visit the My Digicel app to buy. Digicel, better together.
When he joined the army, everybody was proud of him because it's the first person in the family that was in that career.
Every recruit gets a chance, or sometimes will get a chance to be what you call a squad leader or section leader. I knew I was going to be a squad leader at some point.
Garth would have been one of the people who kind of stood out in the platoon because he showed a lot of potential. Not just in sports, because we play basketball together and all that. We take on all the platoons, we win and everything. As a matter of fact, our platoon was about the best platoon that they had.
He was always highly energized about being in the defense force. He wanted to be a soldier. So it was very easy to train him. And he was all about being physical.
One day it happened where our squad leader, we went out to do drill, and when we was coming back in, one of the instructors noticed that he put on his shoulder tightness upside down. So the TTR was upside down. And I was right on spot to see that. So the instructor asked him, "You just turn over the whole regiment," and ripped the chevron off his shoulders. And says, "Where's St. Clair?" I said, "Right here." Instructor, he said, "Come." And he put on the white chevron on me.
Normally, they might give it that for a week and pull it off his shoulder, but he had it for the longest time.
During training, they would change squad leaders as time go down. If a recruit doesn't get right, the corporal will come and vigorously rip off the tape of him to place on somebody else.
You know, he always had that thing about him.
When they made Garth a squad leader, Garth was a squad leader from the beginning of training until the end.
When she heard, she started getting news about how I was going during the training. You know, people started telling her. Well, she thought, as a neighbor told me, "Boy, your mother cried for days."
Sometimes when people are placed in areas of responsibility, like Garth was, he took it very serious. And he took everything extremely serious.
And you could have seen he would have made something of himself because he was shooting. When I say shoot, I mean like moving forward.
We always kind of keep an eye on him because he was always, out front. It's good to be fit as a recruit because life is easier when you're fit. So he was doing pretty well.
And my first company was Delta Company. We stayed in Tetra and Barks for a while, and then Delta was going on the honor guard. Young soldiers weren't allowed to go on the honor guard. Once you had less than 5 years service, you couldn't go on the honor guard. That was the Prime Minister and President Guard. So we were transferred to Bravo Company. They said we had to go to Tobago. No, we didn't want to go to Tobago. I just passed out, you said in us Tobago. But as they said, you sign up, you go where they tell you to go.
We went to Tobago to serve for a lengthy period. When we worked in Tobago, he took part in basketball there. He even trained a team across in Tobago.
The tour of duty was coming to an end, and we were coming back to Trinidad. I went to try to get on the PTI course. They said it's for old soldiers, you must have 5 years and more service. So we just said, "St. Clair, I think they will take care, because as I say, you just have 2 years service."
It struck me so strange, and I found I was so lucky to get on a PTI course so early in training.
He did the PTI course, which he also excelled on, because the PTI course is all about fitness. And he was fit. Loved to play basketball, so it had a basketball element. He could run, wanted to swim, he could swim. So we had all elements of that on the course, to which he excelled.
That's one thing with the defense force. They don't ever hold you back once you have a skill. They see that you excel, they will push you forward. And I broke that glass ceiling because I said you had to be 5 years and over before you became an instructor, a physical training instructor. But I stood out and I became a physical training instructor.
Going to Defense Force Headquarters would have been after he had done his PTI course and was selected to be on the PTI staff. Right? You can imagine how you would have felt that some of the people that would have trained you, you're working together with them now.
The PTI staff was almost like the hallowed unit of the Defense Force. They had their own commander, we had everything, we had our own quarters and everything. We wore white. And I settled in there for about 3 years until I decided that I would study for exam. So because I wanted to become a commissioned officer. Wanting to become an officer was part of the ambition. I really think that I could have gone to that level of leadership. But to achieve that, I had to have 5 subjects. I didn't have 5 subjects. So I decided that I was going to go back to school. Now that would have been, I didn't know that would have been such a task because as a PTI I had to be up. And by that time I was in charge of training youth camp. And then from youth camp we would come back to the base. I was really tired, I was running whole day. And then the PTI course, the same PTI course that I was trained on, now I'm an instructor on that course. So now I have to go report to the Gene Peer Complex, that's when the PTI course was. And so it was difficult to study at night. Morning time I would wake up like 2 in the morning, try to study until about 4 and then change, get ready for when the guys come in and we go Shagamas youth camp. And one morning, while I was sleeping on my books, I guess, I felt a nudge. And when I raised my head, I saw this soldier standing there. And he said to me, "You're sleeping on yourself, soldier." I said, "Tired." He said, "Okay, don't worry yourself." He said, "I would check you tomorrow. And I'll give you something that will keep you up in the night." I said, "Boy, anything that keep me up in the night, I welcome it because, I want to get these subjects." And kept his promise. He showed up the next day. He was waiting by the almond tree, that famous almond tree on the base. And I sat in the car and he dipped in his map pocket and he pulled out this thing wrapped in foil. So I said, "Okay, what is that?" He said, "Well," "there's a new thing on the scene." He said, "Call this crack." I said, "Okay." I said, "So that will keep him up in night?" He said, "Hold on." And so I was introduced to that. Then he showed me a brandy bottle, a miniature brandy bottle. It looked kind of dirty. He said, "We could put it here and you could light it here." And he came well prepared. I remember taking the first hit of that crack cocaine. And I just entered a different world from that first hit. A lot of guys fell by the wayside with that, I myself included. Yancy, having looked at that clip and hearing the comments from the guys I worked with and members of my batch, they are more like me in the military.
Yeah.
Why didn't I just say no? After hearing how good I was and bringing back some of the memories now, why didn't I just say no?
I think that's a question you will have to answer yourself. But I understand why you're asking the question. And within particular types of environments, like the military, like the police services, those protective services, there seems to be some sort of culture where it has become the norm to use substances as support. So there's, a lot of alcoholism within the protective services in Trinidad and Tobago. So you have a lot of functioning alcoholics walking around in those services. And in some respects, I think, yes, that was your safe haven, but you used it for a purpose. You wanted to achieve. So I think you shouldn't just focus on the negative part of it. You actually went to use that substance for a purpose to help you to be a better Army officer.
At what point does it become a disease? Because we want people to treat addiction as an illness that can be treated. So at what point do we recognize that it is something
I think it's when we're doing something that we don't have control of and that is interrupting the normal flow of our lives. Yeah. Yes? And so cigarettes, alcohol, coffee for some people, tea for other people. It's those things that we do which start to control themselves when they are done, and which interrupt the flow of our ordinary lives.
We extend our sincere thanks to all the health professionals for their time and to our guests who generously shared their lived experiences with us on Iron Dependency TV.
And an extra special thanks to the Ministry of Health, without whom none of this would be possible. Be sure to catch Iron Dependency every Sunday from 6:15 p.m. exclusively on I-95.5 FM.
Take care.